Hi, I'm Dr. Young. I just want to talk a little bit about fat injections. There's a common belief out there that fat injections actually, and fat itself actually doesn't survive very long, but I definitely think that fat is a great alternative to make someone look younger. Now, as you age, you lose volume in the face, and that can lead to your skin sagging and creating a lot of wrinkles in your face. And some of the more common ways to counteract that include dermal fillers like Restylane, Juvederm, Radius. Now the problem with those dermal fillers is that they only last maybe 6 to 9 months, and the one that lasts the longest is Radius, and that lasts approximately a year or two at most. Now fat is a great alternative because if it's done right, it can last 8, 10, and 15 years, or up to 15 years, and it really all depends on the technique that you use to harvest the fat as well as to place the fat. And if you go to the right doctor, he can definitely do it in the right way so that it can ensure that the fat lasts a lot longer than just a year or two. Some of the ways to help ensure that the fat survives include when the doctor actually harvests the fat, you definitely don't want to use too much pressure, negative pressure, when you actually carefully liposuction the fat in different areas such as the stomach, back of the arms, as well as the hips and inner thighs and so forth. And you definitely don't want to wash the fat, expose it to air, or traumatize it, as well as when you actually refine the fat in a centrifuge where it spins and refines the fat. You definitely don't want to do that for very long. You want to limit the amount of time that you do that for approximately 2 or 3 minutes, and you don't want to use high speeds. All those different elements make sure that the fat, or ensures that the fat can last longer and survive and find its own blood supply within the body as you inject it. When you importantly, as a person implants that fat, there are many techniques to ensure that the fat survives. Now you definitely don't want to inject the fat in big amounts, in globs, because that way the fat is placed in a big volume and it's not close enough to blood supply to allow it to receive nutrients and live longer. Essentially the fat has to be close to a blood supply, approximately 1 or 2 millimeters. And so what that requires is it requires a surgeon to layer the fat in multiple different layers and different directions. You have to lay it along the bone and gradually more superficially until you fill the whole tissue layer, or the area of the anatomy. So all those different factors can help, and if you get the right surgeon, you can definitely make sure that the fat survives and ensure it's the length that it stays in there. And ultimately it can help you look younger and natural. Thank you.